Our lead speaker will start now, Dr. TERESA Pounds. I hope her slides are ready. Are they ready? Is it ready?
They're looking for my slide.
They're still looking for it?
Or they can give me back my phone. They just won't have slides. I'll top up my phone.
Oh, did they take your phone now?
No, yeah, because I told them
okay,
to send it to the person and they can retrieve it.
Okay. Okay, just a moment. We're trying to resolve some technical issues here.
What's this topic?
Yeah, it's the same topic. Well, you're the lead speaker.
Oh, okay.
And we have how many speakers here? I think one of the speakers is coming virtual. Are we good?
Just send it. Just write it.
Can everybody hear me? Yeah. While we're waiting on the slides, again, I apologize for the inconvenience. They don't have my slides. I think everybody pretty much knows who I am. I'm TERESA Pounds. I'm a clinical pharmacy specialist. I practice in the hospital setting. I'm also, as you all know, the president of NAPPSA. But I'm talking to you today as a clinician who has been involved with the vaccination program, coming to you from the United States. But before I start, I would like to get a feel of how many of you are practicing in the hospital. How many are in the hospital setting with a show of hands? Hospital setting, awesome, very good. How about community pharmacy practice? It appears that community pharmacy appears to be the most. Okay, how about in the academia? Academia, very good. All right. Now, in addition, I also have some people here from United States who also are very involved in vaccination program. So maybe when we have the all right, sorry about that. So I will also, when we have the question and answer session, I would like some kind of interactive discussion whereby you guys can also hear from some of the pharmacists in US what they do in terms of the vaccination. Is the slide? Okay, can she just give me my phone? Let me talk off the slides, man. Do we have any PCN representative in the audience? PCN representative in the audience. Awesome, very good. They can just give me my phone. I'll speak off my phone.
So I actually went around all vaccination.
Okay, so maybe you can go first. Okay, but my slides is not there. Okay. Yeah? Yeah? They've seen it? Okay, great. All right, great. All right. Again, I apologize for the delay. What I'm going to cover today is information about vaccination and primary health care with a focus in pharmacy. But before I start, let me stress that, let me see. Okay, yeah, that's right. And then goes back. All right, so irrespective of your area of practice, whether you're in the hospital or in the community or in the, in the clinic, ambulatory care, you are a clinical pharmacist. And we will get a chance to discuss some of the things that the clinical pharmacist does in the primary health care, but our focus today, what we're going to talk a lot today is the vaccination. Looking at the primary health care background, pharmacists are dedicated to the preservation and advancement of public health. And I think you all will agree with me with that statement. Their efforts enhance the quality of your lives by helping us to live as free as possible from diseases, pain, and suffering. This is a famous quote from somebody, unsung heroes, that was in the New York Times, 2005. A little bit about the primary healthcare background. The focus is a whole society approach that includes health promotion, disease prevention, treatment, rehabilitation, palliative care. So there is a generalist approach looking at the whole society approach. The focus is on the overall and interconnected components of physical, mental, social, and social health and well-being, as well as larger determinants of health. It provides whole person care for health requirements throughout a person's life, rather than solely for a specific diseases. It also requires that people receive quality, comprehensive care feasible to their everyday environment. So what is actually the role of the pharmacist in the primary healthcare environment? It's comprehensive, it's coordinated, and continuously provided over time by individuals or a team of healthcare professionals according to their needs. Pharmacists have a role in meeting the primary care needs of patients by fulfilling their responsibilities to provide pharmaceutical care. I think this is where we need to do a little bit of discussion. What is pharmaceutical care? Now, in US, there are certain states that the pharmaceutical care, the pharmacist can do a little bit more, and maybe through what you call the collaborative drug therapy management. Now, pharmacists establish relationship with patients to ensure the appropriateness of medication therapy and patients' understanding of their therapy and to monitor the effects of the therapy. How does the pharmacist patient care process apply to the immunization process? Excuse me, went down, yeah. When you look at the pharmacist patient care process, which is the PPCP to immunization services, is actually aimed at adapting the PPCP's general model, which includes collecting the information, assessing the information, planning, implementing, and following up through monitoring and evaluation. And we'll talk a little bit about that. Now, a pharmacist can use the PPCP knowledge to assess or evaluate the patient's vaccination needs, as well as make any other determination that could impact the administration of the vaccinations required. Now, what this slide shows is actually the pharmacist patient care process. As you all can see, the point that I mentioned, which is the collect, the assess, the plan, implement, and the follow-up and monitoring. These are key components. So let's look at the pharmacist patient care process in terms of the collecting. The pharmacist, when it comes to the vaccination, assures that the collection of the necessary subjective and objective information about the patient in order to understand the relevant medication history and clinical status. In a layman's term, so a patient comes to you, they have to have the vaccine. You need to know about that patient's history. What is the patient's clinical condition? Any medications, are they allergic to any medications? Allergy information. So that information has to be collected. So that's what that is. Now, once the information is collected, the pharmacist will assess the information collected, will analyze the clinical effects of the patient's therapy in the context of the patient's overall health goals in order to identify and prioritize problems for that patient. So when you're talking about vaccination, you have their clinical information, the medications they're on. You've asked them questions about, are they allergic to any medication? If they're allergic, what type of symptoms do they have? Then you assess it, okay? Then you go to the next phase, which is the plan. The pharmacist then develops an individualized, patient-centered care plan. And that's why when we keep talking about the multidisciplinary team approach to patient-centered care, this really shows what we're talking about. The patient is the center, and the care has to be surrounded around them. And then the next step is implement. The pharmacist implements the care plan in collaboration with other healthcare professionals and the patient or the caregiver. And then, of course, the last step is the follow-up, monitor, and evaluate. And maybe we'll get some chance to talk about all this when we look at specific cases from those who are actually vaccinating patients and see how they're applying this. This tells you about the pharmacist's position. When you look at patient-specific services, what the pharmacist does in terms of clinical or even this vaccination, the pharmacists are actively involved in patient education. The pharmacists, when they look at the medications, have to ensure that there's no drug interaction and that they have to do drug therapy monitoring. But our focus today is vaccination, so I want to talk more about the vaccination and then the collaborative practice agreement if we have time. Then if it's facility specific, You have to have some protocol, some policies, and pharmacists can also be involved in research when it comes to the vaccination. Also medication safety. For example, if there are medication errors, pharmacists need to be involved in terms of collecting that. And then, of course, the financial stewardship. And then there you can see the, in terms of the global services, what that pertains to. A pharmacist, in order to be involved in the vaccination, have to have the competency and the skills. One, of course, professionalism is very important. Example of the professionalism would be you have a patient, they have certain information that is confidential, you keep it confidential. That's part of your professionalism. Accountability. You need to have services. When you say you open 8 hours or 9 to 5, you open. When so the patient is not there waiting too long for the vaccine. So accountability. Responding to change. Drug information. Definitely something the pharmacist has to be on top of. You need to know the current information about vaccines. What's the current literature? Is there any kind of latest information that needs to come in place? Patient education. You are the patient's advocate. You are the one that the patient will come to, so you will need to know the information to talk to them. Clinical interventions. We talk a lot about, we need to talk about pharmacist value. We're talking a lot about the physician really understanding that pharmacists are key to a medication therapy. How can physicians, how can people really value if we do not document our interventions? So any interventions we do with the patient, we need to document it and we need to categorize it. Is it intervention that has a pharmacoeconomic implication? Is it intervention that has a patient safety implication? So those are the ways we continue to show our value. Then here it has the pharmaceutical care, the medication safety, and then the patient family-centered care, which is all intertwined. So looking at the vaccine, there are 3 effective cornerstones of immunization practice. You have the individual, you have the healthcare providers, and then you have the regulatory authorities and supporting organizations. You guys heard me ask here in Nigeria about PCN. When you're looking at the regulatory, PCN definitely will play a key role here. In United States, in most states, pharmacists can vaccinate. So, and also immunization and vaccination is part of the student curriculum. I know we're working towards that here in Nigeria. It's not quite here that yet. So when you're looking at the scope of practice in US, because students already do this in the pharmacy school, they already come out of school knowing how to vaccinate and immunize, you know. So this is just, let's look at what's going on in terms of global assessment of pharmacists' involvement in vaccination. Just wanted to give you guys a little bit taste of that. Now, the World Health Organization estimated that vaccinations prevent between 2 and 3 million deaths each year. It's documented. Due to the devastation and unprecedented loss of human lives caused by the COVID-19 pandemic, the human race is saddened with the responsibility of ensuring that everybody gets vaccinated. Now, due to emergency changes currently seen in the healthcare worldwide, countries taking the initiative to expand pharmacists' role to include responsibilities such as vaccination, prescribing rights, and drug therapy management. That's going on. But what I want to focus is vaccination and drug therapy management. Pharmacists are perceived as affordable, easily accessible, trusted healthcare providers, which explains why globally patients first seek care from the pharmacist before anybody. If you look at the literature, pharmacists are one of the most respected disciplines, and that's the first discipline the patient goes to. So that's why involving pharmacists in a lot of initiatives, such as vaccination, definitely we kind of help at the global thing. Pharmacists also operate on a more flexible schedule, making them more attractive to patients who are under strict time constraints. Countries such as US, Argentina, Australia, the Philippines, South Africa, and UK have legally authorized vaccination by pharmacists. So if we look at goals of providing vaccination services, we need to look at what's the value. The value is involving more disciplines in vaccination can increase the global prevention of death and disease through safe and effective vaccination. So it makes sense that pharmacists as trusted health providers, if they are included, that would really be a good thing to look at. And I have to say, I know there are some things in the works here in terms of that happening. Although immunization services have been remarkably successful in preventing deaths among patients of all ages, substantial challenges remain. The other thing is that we also have to look at developing new and improved vaccines. We have to amplify the vaccine safety system, and of course, we have to ensure a stable supply of, access to, and better use of recommended vaccine. I think we heard a lot today from the presentation from the DG of NAFDAC in terms of the vaccines that are available here, you know, and it looks like we're making improvement in terms of where we're going. But these are some of the goals, you know, we have to kind of look at. So what is actually the pharmacist's role when it comes to vaccination services? The first one is an advocator. The pharmacist, even without having the authority to vaccinate, the pharmacist is still the one that should know about vaccine, should educate the patients, the public. So educating, motivating patients, telling them the advantages of vaccine, telling them what the vaccine is all about, and encouraging them to be vaccinated. So as an advocator, there should also be a facilitator, meaning hosting orders who vaccine. So even the pharmacist is not vaccinating, and there's a doctor's office, a physician's office, you can help with the supplies, you can help with drug information, and be an advocate. And then the last one is the immunizer, whereby you're actually administering the vaccinations. So like I was saying, in US, most of our pharmacists are actually administering the vaccinations. Provision of effective vaccination is definitely a fundamental concept for the prevention and eradication of the communicable disease. I think we all know that. As practitioners on the front line, pharmacists can address barriers relating to immunization and vaccine hesitancy. Pharmacists can initiate discussions, like I mentioned, about immunization with patients. They can provide vaccine, disease state education, and ultimately make recommendations. So these vaccination practices are consistent with the preventive aspects of pharmaceutical treatment and have been predicted. So the point here again is making a case for pharmacists' involvement in the vaccination process. Can be the educator, can be facilitator, and in cases where they are allowed to vaccinate, they can also be immunizers. So what have I learned about the position of healthcare in Nigeria with everything I'm learning? I think I can safely say that in Nigeria, pharmacy is evolving from a product-oriented practice with traditional roles of medicine distribution and counseling to a patient-oriented practice, while more focus is placed on clinical pharmacy role. So I can say there's definitely an evolution. Are we there yet? I will probably say not quite, but it's encouraging that we're moving in that direction. But despite this evolution, Nigeria needs more high-quality healthcare professionals to meet the healthcare needs of the 173 million, maybe even change now. So I think what that's saying is that we still need more. And why? Continue with this, and I want you guys to correct me if this is wrong. I think there's a shortage of healthcare workers in Nigeria. If you're looking at the nurses, midwives, and doctors, and then when you look at about 95% of pharmacists in Nigeria are probably small, medium-sized enterprises with their own brick-and-mortar retail. So the bulk of these organizations probably operate in silos from the country's primary healthcare structure. As a result, efforts to attain universal health coverage are hampered by a lack of community pharmacists' contribution, as well as shortage of resources. The point I'm making there is the community pharmacists are the key. The community pharmacists are the ones the patients will see. So the more involved the community pharmacists are in with the vaccination, the better. Now, the community pharmacists are the pharmacists that prevent patients from getting sick, from getting admitted to the hospital. So you see, it's a very fine line. The hospital pharmacists see the patients when the patient is already sick. The community pharmacists and the pharmacists in the primary health care deal with the patients, they take care of the patients and prevent them from being admitted to the hospital. So when you're looking at pharmacoeconomics of the healthcare system, community pharmacists, primary healthcare pharmacists, hospital pharmacists have to work hand in hand to ensure that that's done. Because your goal is you don't want to get patients admitted to the hospital. Even if they get admitted to the hospital, you want the pharmacist who is decrease in cost, and they're giving the health care. So that is a very important point that I'd just like to make. So what is the justification for pharmacists' involvement in immunization? One is the frontline patient practitioners. I cannot stress that enough. Pharmacists are frontline practitioners. They are involved in the burden reduction on other healthcare practitioners and convenient hours. And they have easy accessibility for the patient's vaccination needs. I think I already mentioned this, that they're well positioned to provide education and vaccination services to the clients. They can begin conversations with the patients regarding vaccination and provide vaccine and disease education, and they can make recommendations. Burden reduction on other healthcare practitioners. Patients tend to take advantage of opportunities to be vaccinated at times of the day that are outside the physician office hours. What that's saying is, a lot of time, if patients want to be vaccinated in the physician's offices, that works out better for them. Easy accessibility for patients' vaccination needs. Empowering pharmacists to provide vaccinations provides easy accessibility to needful patients who can conveniently walk up to a nearby pharmacy. Now, so what are the gaps? What are the gaps in terms of pharmacists' involvement in vaccination efforts? I want to start. Okay. Oh, sure.
Sorry for the interruption. The second symposium from the farm to the pharmacy, research and development, will be chaired by PP Ahmed Yakasai. It's supposed to start at 4 p.m. But not 4 p.m. Well, just okay. Sorry about that.
So
yeah, we'll be here and not in the other place.
So it's not,
immediately after this.
So it's not.
Yeah. Yeah. Thank you.
Thank you. So these are just the gaps, you know. I think the key point is The regulatory agencies are still working on putting processes in place for pharmacists to eventually be able to vaccinate. One, they're looking at the curriculum. It has to be part of the pharmacy curriculum, and that's been worked on. And then they're also looking at primary healthcare being, providers. That's been worked on. But the way it is right now, pharmacists are not authorized to vaccinate people in Nigeria. Colleges and schools of pharmacy in Nigeria do not have vaccination education as training as part of the academic curriculum, like I mentioned. These deficiencies in immunization education and training in Nigeria colleges probably can be contributing to the low rates. Now, the last bullet point, multidisciplinary team approach to provision of clinical pharmacy service is not where it needs to be. It's still evolving. That also needs to be a key. So these are some of the gaps that at least are identified. So what is the way forward? Although the curriculum for pharmacy school in Nigeria are reviewed continually with the aim of attaining the dynamic competency required to reflect the paradigm shift, we still need to look at, and like I mentioned, they're looking at that. Now, if you consider the advancements witnessed today in pharmacy education all over the world, changes in pharmacy education curriculum and training in Nigerian schools is something we really need to look at to address that. And I know the Nigerian Association of Pharmacists, NAPPSA, we are available. We will continue to collaborate with whatever entity to kind of make this happen. So that's the way forward, the education. So I think that's all I have today. We'll leave it for questions.
We'll take all the speakers. Please make notes of your questions, because it's the same topic we're discussing. Now, Fagi, are you ready now, or we take? What about the man coming? I have one of the speakers who is going to speak virtually. But Fagi, come on, go on. Carry on, Fagi. Is that yours? Malam? Is that yours coming up? Or you have a slide too? Okay, put on his own slides. Let's just get on with it. He's coming virtually. Okay. All right. The second speaker, IKWE, is presenting from the US. So let's listen. Yours? Okay. So it will be different. Yeah. Okay.
So maybe you should focus on that. Maybe some things that
Okay, that's fine.
That's what he should. But how about the other speaker?
Well, I don't know.
He's a medical doctor. Okay, so he's coming.
His own perspective may be different.
I'm speaking from the pharmacist. You're a pharmacist? So you just thought the
Okay, let's go on. We're pressed for
Yeah,
time.
hello. Yeah, hello. I just want to be sure that you can hear me clearly.
Can hear you. Can
Oh,
hear you.
yes. I'm very sure that people that are online can hear me. But I think for the people who are in the hall, in the physical presence, I'm trying to be sure that they can hear me before I go ahead.
Okay, that's fine. Congratulations.
We can hear you.
All right,
Those of
absolutely.
us online.
Yes, that's true. Hi, Mom.
Okay. The speaker you're viewing now is Dr. Hardley IKWE from the U.S. Center for Disease Prevention and Control.
From US.
Yeah, from the U.S. So you have 10 minutes. Please go on.
All right, thank you so much. Just to confirm that you can hear me clearly.
Yes, we can.
Dr. IKWE, can you hear us? Please go on.
Yes, I can hear you.
Yeah.
And you hear me?
Go
Yeah.
on. You're on.
I want to confirm you can hear me before I go on. Oh, great. So all protocol duly observed, and it's nice to be here, to be invited to this August gathering of very important people and an opportunity to talk about vaccines, as well as the role of pharmacists, in ensuring that vaccines reach the world. So for Nigeria, I just want to first congratulate everyone on the 94th Annual National Conference for Pharmacists in Nigeria, and this opportunity here, and this theme titled COVID-19, the lessons from COVID-19 in terms of broadening and strengthening the Nigerian pharmaceutical health sector is very important and can be overemphasized at a time like this. Nigeria, as well as the whole world, is facing an unprecedented event. This is the first time we're having the large-scale vaccination we're having in terms of the threats that we have from COVID-19. And we all know that vaccination is one of the greatest breakthroughs for science for the 20th century, as well as the 21st. This is something that has changed the way public health has moved, and the role of the pharmacist is very important. So I would first say that, and agree with most of the speakers who had talked earlier, the pharmacists were the last line or the first line of defense, when COVID came, and the last man standing was really apt. And I think this is very important when we talk about a conference like this and we're talking about vaccination in terms of COVID-19 and the lessons that we're learning, from the way man has come to see the threats that keep coming up from time to time. I know that the pharmacists are really an integral part of the primary healthcare structure and ensuring that healthcare delivery or service delivery in an integrated manner is also broadened. And this has been alluded to by most of the people who had spoken earlier before me. So within the integrated health systems, pharmacists' responsibility includes ensuring that there's the right regulation, ensuring that there's the right safety monitoring for vaccines, ensuring that we have the right planning. Production of vaccines is also very important, in terms of the pharmacist's role and having the supply chain even to the last mile. These are some of the issues that we still face in Nigeria, ensuring that the right vaccines in the right quantity, in the right cold chain, and the temperatures get into the arms or into the bodies of people to improve immunogenicity. And the role of the pharmacist cannot be overemphasized across the supply chain, from production into having efficacious vaccines into the arms of children and adults. COVID-19 presents a unique challenge and a unique opportunity, at this time, for us to look at the roles of of pharmacists in how vaccination exercises and vaccination campaigns go ahead. Nigeria, before now, just a year ago, had certification for polio eradication. This was a huge feat because it wasn't just Nigeria, but the whole of Africa that was getting this certification at the time. We're looking at COVID-19 in terms of how these threats continue to come to the world and what we have to use vaccination for to improve health outcomes, herd immunity, as well as protecting the population from imminent threats. And the pharmacists, especially the community pharmacists, like most have said, sector reform, which is also a very important part of improving primary healthcare. The primary healthcare summit's been planned, and also the plan by the president to have a health sector reform, ongoing to ensure that the health system is in an integrated fashion, improving health outcomes for Nigerians. Is also very important to have pharmacists in these kinds of places. It is very important that from policy, where policies are made for countries like Nigeria, which contribute unevenly to some very high levels of disease burden, that things around vaccination should also have pharmacists sitting in these policies to ensure that we have the right laws enacted to help in improving health outcomes. Community pharmacists continue to also be part of a team that improves the quality of care for patients management, from preventive medicine through corrective medicine and rehabilitative medicine. This multidisciplinary team that we keep talking about, providing quality care to healthcare workers. One thing that is an issue, continually in a place like Nigeria remains the lack of human resource for health. And as we continue to churn them out, we lose a lot of them even to other economies, due to different challenges. And there's also the need for pharmacists to be remunerated in areas where they work to ensure that community pharmacists are encouraged to remain in those areas where this is needed. Primary healthcare remains to be improved in those areas, in the hinterlands and the hard-to-reach areas, riverine, and even humanitarian and conflict regions in Nigeria, as well as other places in the world. And the role of pharmacists can be emphasized in those places. Pharmacists have the obligation for vaccine education, just like I heard the last speaker say, as well as appropriate resolution of vaccine hesitancy, vaccine safety communication to improve the confidence, reduce complacency in people, as well as reduce rejections, especially block rejections for people who are anti-vaxxers. I think this is just some of the issue, and the pharmacists that things around healthcare are brought to the.
Hello? Okay, thank you very much, Dr. IKWE. We just hang around. All right.
Thank you, sir.
Mohammed Rabiu Fagi, your turn. This one is okay. Thank you.
So thank you so much, Mr. Chairman. My colleagues, good afternoon. My name is Pharmacist Rabiu Muhammad Fagi. Actually, I'm a MCKING consultant working in Bauchi State, supporting the integration process between routine immunization and primary health care services, working directly with the government of Bauchi State, most specifically targeting primary health care services. I have worked with Kano State government, and I've also equally worked with UNICEF as the National Vaccine Security Logistician. I'm a vaccine logistician, and I'm today going to be very brief in talking about the relationship between vaccination as it relates to primary health care and also the role that pharmacists actually play. I will hang around for, hello? I think this was, I will still hang around for some couple of seconds for my slides to come on. I really appreciate the two presenters making my work very easy, talking about the role pharmacists actually play as clinical pharmacists in vaccination, while I'm actually going to look at an entirely different perspective and different angle, talking about how pharmacists are supposed to actually manage vaccines as logisticians. How are they supposed to actually handle cold chain equipment, because they are responsible for that? How do they effectively and efficiently distribute vaccines to different locations? And how do they track data of vaccine supply chain that comes back to them as it relates to the program data? I will also briefly talk about primary health care and also what pharmacists need to actually focus on, because we have a lot to do as far as primary health care is concerned. We seem to be focusing most specifically only on the supply chain side, but there are ample opportunities for pharmacists to actually grab as far as primary health care center is concerned. It is needless for me to say that primary health care is currently the focus of, it's a global focus, and that is where the supports and even funding is tilting towards to. So before I take on this, I would like to just briefly, don't mind my long slides, I actually prepared for the whole presentation, but it will be important for us to actually understand, coming from the primary healthcare perspective. I know if you talk about primary healthcare, the first thing that comes to everybody's mind is the Alma Ata Declaration of 1978. And I would like to say at this point that the Alma Ata Declaration, even though it was the first declaration that brought in primary health care in 1978, it has been reviewed recently in 2018 in the same Kazakhstan, in Astana. And I think it is important for us, putting Alma Ata at the back of our minds, to know the focus is no more really on Alma Ata Declaration, but it's moving towards the Astana Declaration of 2018. Of course, from the primary health care, we all know that it is essential care that is based on practical, scientifically sound and socially acceptable methods and technology that should be made universally accessible to individuals and families in community through participation at a cost that is affordable to the community and the country. But this is actually the Alma Ata definition of primary health care. In Astana in 2018, that definition was redesigned to capture primary health care as a whole of their equitable distribution by focusing on people's needs and as early as possible along the continuum from health promotion, disease prevention to treatment. It is important to say that there are actually 8 elements of PSC, of which we have always persistently been. Health education is number 1. Promotion of food supply and nutrition is number 2. It is high time for us to see pharmacists that are actually consultants and in nutrition, because they are really actually needed. And I know we have some couple around. We also need to have an adequate supply of both safe water and sanitation. Maternal and child health is very critical, including family planning as far as primary health care is concerned. Of course, immunization, which we have been talking about since. Then prevention and control of endemic diseases and treatment of some common elements. The primary health care principles are equitable distribution of health facilities, community participation. I think one thing that comes out very primary health care actually is focusing on communities and how do we as pharmacists are able to reach out to communities to prevent diseases, to promote better health care, and also to support in prevention. So in Astana in 2018, these are the commitments: to make bold political choices, to build sustainable PSC, and to empower individuals and communities to also be able to align. We also know that the PSC under one roof, which came about and also was the reason for the establishment of all the state primary health care development agencies, has been passed and is currently being implemented across all the 36 states plus FCT. And the PSC under one roof, its principles involve integration of all PSC services, reproductive health, maternal, child health, adolescent, and nutrition. It also needs to have a single management body that controls all the resources, both human and financial, including services. We need to have a decentralized authority at the LGA level. we have one single management team that will have one single plan and one MIE framework. Also, an integrated supported supervisory visits, effective referral system from the lower to the higher facilities and even backward. And also, enabling legislation and regulations. As I said earlier, these are the structures of the primary health care, which include the federal ministry under the National Primary Healthcare Development Agency. At the state level, we have the state primary healthcare development agencies, and we have the LGA health authorities. We also have village development committees and ward development committees that are crucial in ensuring there is quality health care for all, and also the health facility management. I think this is as far as I can take for primary health care. Now, coming back to the role of pharmacists as far as vaccine logistics, supply chain, temperature monitoring, vaccine distribution is concerned, I think it is important for us to have more of our colleagues around, especially at the primary health care level. We know immunization, needless to say, that immunization has been able to prevent illnesses, disabilities, and deaths. Immunization also, this is a WHO data that says immunization abates 2 to 3 million deaths annually. Of course, also in Nigeria, 230,000 lives are saved annually through immunization. And we know that immunization and vaccination have, and even inoculation have been words that are used interchangeably. Immunization, the first actually vaccines to come on board was in 1796 for the smallpox vaccine. And as you can see today, in 2020, we have the COVID-19 vaccine. Okay? Different types of vaccines. This is a slide that every pharmacist is aware of. For an effective logistics system, you need to have the right materials. For vaccine supply system, you need to have the required vaccines with diluents, which means with the diluents and the syringes and every other thing in the right quantity, so that you do not give a facility vaccines that are more than its requirements or below its requirements. Also, they have to be in the right quality. Quality here is talking about vaccines being in the right stage, because in vaccine logistics, you have 4 stages which we'll talk about later. Stages 1, 2, 3, and 4. Vaccines in stage 1 and 2, you can use them. But vaccines in stage 3 and 4, you cannot use them, you have to discard them. So you do not distribute vaccines that are already in stage 3 or stage 4. Those as you cannot distribute vaccines that are already expired. They need to be at the right place, at the right time, and of course the right time. We have 2 types of vaccines, as you are well aware, the single-dose vaccines and the multi-dose viral vaccines. Also, vaccines come either in lyophilized or non-lyophilized. As I said earlier, vaccines, once they are reconstituted, if they are lyophilized, then you can use them for a maximum of 6 hours. After 6 hours, you must discard even if you didn't finish them, because vaccines that are lyophilized do not come with preservatives that can maintain their potency after 6 hours. And for vaccines to be able to enjoy multi-dose viral policy, which means giving vaccines for 28 days after opening, they need to conform to these 4 criteria. Also, some people will think that vaccines, because they are kept in fridges, they love cold more than heat. I think that is one irony with vaccines. Vaccines are more scared of freezing as they are of heat. Heat destroys freezing destroys vaccines more than actually heat exposure. Because once you expose vaccines to very low temperatures and they get degraded, they can never be used again. That is why they are supposed to be kept between 2 to 8 degrees, plus 2 to plus 8. Anything below 0 degrees is very, very dangerous for vaccines, and they will freeze. And the moment they freeze, you cannot use them anymore, you have to discard. But some vaccines can stay in this room temperature for 30 days, and they will not even move from stage 1 to stage 2. Okay? But if you keep any vaccine for an hour in 0 degrees or minus 1 degrees, that vaccine will freeze and it will just be useless. Some vaccines are also photosensitive. moving forward, as I said earlier, once you suspect a vaccine is frozen, then you need to conduct what we call the shock test to ensure that that vaccine has not frozen. If it has frozen, then you have to discard. If it hasn't, then you can continue using it. I also said earlier there are 4 stages of vaccine biomonitor that you need to monitor. And vaccine biomonitor simply tells you the level of exposure of vaccines to heat. Even though I know that WHO is talking with some experts to increase BBM stage from 4 to 6, but currently we have only BBM 1, 2, 3, and 4. BBM 1 and 2 you can use, BBM 3 and 4 you cannot use vaccine at that stage, so you have to discard. You can also store vaccines only at plus 2 to 8, especially at hospitals. At national level, you can keep some of the vaccines, especially oral polio vaccine and the lyophilized vaccines, in your working freezer rooms for as long as 6 to 12 months. Also, vaccines are being arranged differently based on different cold chain equipment. For a standing refrigerator, the way you arrange your vaccines is different if you are using a chest refrigerator. So also if you are using different cold boxes. This is how we actually determine or we estimate the requirement for vaccines that are at facility level using target population method or consumption method. Different type of cold chain equipment. It is important for me to mention at this point that pharmacists are not only responsible for the vaccines, they are also responsible for maintaining and ensuring that cold chain equipment are functional and they remain functional. So you need to know the different types of cold chain equipment. We have 2 types generally. We have the active and the passive. For the active, we're talking about other electrical, which are the refrigerators, the working cold rooms, the working freezers. For the photovoltaic, we're talking about the solar refrigerators, which can either have a battery or they are even solar direct drive that don't have any battery attached to them. Then for the passive devices, you have the cold boxes and also the vaccine carriers that we use to conduct sessions. Now, it is one thing for you to have a cold chain equipment, it is another thing for it to be maintained. And the responsibility of maintaining that cold chain equipment also lies with the vaccine logistician, who at this point in time we're talking about a qualified pharmacist who actually maintains that. There are 2 types of maintenance, the preventive maintenance and of course the corrective maintenance at all the different stages. Then for the maintenance, you're supposed to note very well the response time that you give to a vendor that is supposed to fix your broken down cold chain equipment. Once you highlight him that a cold chain equipment has broken, when does it take, how long does it take a facility to report to you that? The downtime is the time that it takes the cold chain equipment to break down and to be fixed. Of course, the frequency of the breakdown. Now, one very important thing that is important for us to also highlight on this slide is what we call the inventory replacement plan. The inventory replacement plan actually focuses on the cold chain equipment and shows at what particular year are you supposed to change that cold chain equipment. Cold chain equipment actually become obsolete over time, mostly over a period of 10 years, they become obsolete. Even if they are functional, you will still need to replace them. So this is the template where we use to actually develop that. One last thing that I would like to talk about is the delivery of vaccines. We had to review or redesign the supply chain for vaccines in Nigeria moving from 2013 to now, reducing some of the supply chain points, also adopting delivery of vaccines directly to health facilities. So I think one last thing that it's important for us to note, as I said about freezing, it is important for us to monitor the temperature of our cold chain equipment so that we are sure that our vaccines are actually safe. We have different types of equipment we can use to monitor them. We have the 30-day electronic temperature logger. We also have the remote device. For the remote device, which is most acceptable, you can monitor your cold chain equipment. If you are in China and your cold chain equipment is in Port Harcourt, you should be able to know that your cold chain equipment is functional or not, even though you are in China, you monitor remotely. Then the vaccine vial monitor and other equipment. Very importantly is the role of pharmacists in data management as it relates to synchronizing or actually looking at the data that comes from the supply side vis-a-vis the data of the program. It is not only enough for you to supply the vaccines, but you need to know what is happening to the vaccines. Are they reaching the right people, or are they just being wasted? So this is a dashboard that we developed to actually track that particular performance of the vaccines. So lastly, for an effective vaccine supply system, you will need to have a team of vaccine logisticians, which at the state level is being headed by the pharmacist, who is the state logistics officer, and is supported by other partners like WHO, UNICEF, CDC, and what have you. That is what we call the State Logistics Working Group. And that working group is responsible actually for ensuring that vaccines are available and actually cold chain equipment are properly maintained as far as PSC service are concerned. So I think these are some of the few highlights I would like to give as far as some of the roles and responsibilities of a pharmacist are concerned within the context of a primary healthcare system. Thank you so much.
Thank you, Rabi. Thank you very much. That was Pharmacist Rabi Mohammed Fagi. Now, we have run completely out of time because of the pressure of the following, the second session, which is running concurrently. No, not concurrently. I thought it concurrently after our own. So we'll take just a couple of questions if you have. And the speakers would pay attention. And if you have any question, please show of hand. Then we'll take your question and they'll respond. And then we'll round up and give any. Okay, I see a lady's hand there. I see a guy. That's 3. Is there any hand up? No? Okay, I recognize 1, 2, 3, 4 for now. So let's start with you. The lady in this green row.
Thank you very much for giving me the opportunity. Resting on already established protocols, I wish to appreciate Dr. Pounds and to thank her for all her advocacy and to let you know that we in the hospital, we are becoming more patient-oriented and product-oriented. Thanks to various seminars you have given us in various places. Coming to vaccination, I want to ask a question because like you rightly pointed out, we don't do much in vaccination, even in the hospitals. The issue of immunization is under the nurses, under the public health care programs. Nurses handle immunization in hospitals. Nothing to do with the pharmacist. But I have a question I would want you to address. Please, concerning vaccine hesitancy, how safe, if you can talk to us about this, is COVID-19 vaccine as it pertains to the issue of fertility in young women? Thank you very much. And thanks a lot for everything.
Did you get a question?
Okay.
Did you get a question? Did you get the question? Did you get it?
Thank you. I just want to clarify the last thing you said about the COVID vaccine, COVID-19 vaccine. I didn't quite get that question. The last one. Is it the hospital pharmacist involvement in the COVID-19 vaccine?
No. Currently, what is happening in administration of COVID-19 vaccine is done under the public health programs without hospital pharmacists being involved. Now, my question is, because it's a question that's been recurring in our practice, the safety of COVID-19 vaccine especially as it pertains to young ladies and issue of fertility. Does it have any effect on fertility?
Okay, I see what you say.
You get the point?
So that's a general question in terms of
thank
the
you.
safety of COVID-19 vaccine in young children
and young women
and
especially.
Young women.
Thank you.
Well, that's a good question. The last time I checked, in fact, I know they're still working on vaccines. I know in my institution, let me answer the question about hospital pharmacists being involved in COVID-19 vaccines. In US, hospital pharmacists are, all right? Now, I know we are working on a protocol in my institution for vaccinating the young children. But the physicians are still not comfortable yet, at least in my institution, and I can review further when I get back, for pregnant patients or for patients or for anybody less, like in the pediatric population. Young adolescents, yes. Pregnant patients, at least in my institutions, they're not doing it yet. But I can pose the question to people like EDOG and Kunle. You guys see patients that come in the community setting. Are you seeing anybody, pregnant patients? What is the take from you on that?
So far, we don't have any contraindications with pregnancy as related to COVID vaccine. But this actually gives me an opportunity to talk to you about something I heard this morning about ibuprofen. Please don't take it after you get vaccinated. The whole idea of getting vaccinated is that your immune system, which is an inflammatory system, gets activated. If you take ibuprofen or any other anti-inflammatory, you are contraindicating what you just took the vaccine for. You need that inflammation system to be active and do something, and that's how you get protected. If you take anti-inflammatory, you cancel that out. Don't do it. The right medication to take after vaccine is the acetaminophen, which you call paracetamol. For all other inflammatory and pain-related, ibuprofen is still good. Thank you.
So I hope that answers your question. So is the comfort level in the hospital? I practice in the hospital. Why I was asking Kule and EDOG is that they have pharmacists, so they vaccinate in their pharmacies. So I wanted to get a perspective from them what they see. So a lot of the physicians, at least in my institutions, they don't feel comfortable yet, you know, for the pregnant patients or, you know, but there's no, like you said, there's no contraindication for it. I think there's still a lot of questions we have about the COVID-19 vaccines that people are just still learning as you go. I think we just need to keep our eyes open and continue to learn, you know. In fact, now they're talking about the booster for the Pfizer. Some people are taking it. Like I know when I get back, I'm going to take the third one. I've taken the 2 for the Pfizer. Now people are beginning to take the booster, which is the third vaccine. If you've taken it like 6 months, you know, because I took mine in December, I took the second one in January, so I'm going to take a third one for the Pfizer, you know. So just a lot more are coming about that. We just need to stay on top of it. Yeah. Yeah.
Hashim, okay.
Yeah. Thank you, Mr. Chairman. Well, mine is a question to the last speaker, I mean the person who asked the question. The pharmacist who asked the question. Are you still there? No, my question to her is that her information Was it from an anecdotal report or they were from documented AEFIs? Where is she coming from as a pharmacist, as a scientist? I want to understand where she is coming from. If it is coming from documented AEFIs, then we have cause of concern seriously. But if they were anecdotal reports, then, you know, the concern may be a little low or at a rudimentary stage. Can she tell us more, please? Do you understand me?
Elijah Hashim, I'm the one controlling this, this session. I don't want any coups here. Please, just hold on. Just hold on. Let others ask and answer questions. You will have an opportunity to respond to him. I have one hand up there. Yeah, give him the mic, and I have two because we've really.
Okay, thank you very much for the opportunity. My question goes to Farm Rabi Mohammed Fage. Looking at the storage condition, and majority of the vaccines that we are getting is at the delivery point. So what physical-chemical properties of a vaccine can you give us so that we cannot end up getting a vaccine that is degraded due to too cold or too heat? Can you just suggest properties of a vaccine that we can look at when actually we are receiving it? Just a hint.
Can you come closer? We didn't hear you at all.
Okay.
No.
All right. The question is to Pharmacist Rabi Mohammed Fage. I said, can you suggest or highlight physical-chemical properties of a vaccine that we are going to be looking at when we are receiving a vaccine so that we cannot end up getting a vaccine that is degraded? Because you have said a lot when it comes to the temperature of the storage condition. Looking at our setting here in Nigeria, so can you just highlight a vaccine?
Did you get anything?
Okay, it's on the physical. Okay, it's on the physical-chemical properties of a vaccine. Can you just give us an advice or hint on a particular characteristics of vaccine based on the temperature? Looking at our setting here in Nigeria, we have poor storage conditions, so not so that we cannot end up getting a vaccine that is degraded due to too much heat or too much cold. Looking at the storage conditions.
So thank you so much. So he actually asks a very, very important question. Talking about what do we do to ensure that especially children that are under 1 are not getting degraded vaccines, especially looking at the very harsh weather condition that we find ourselves in country, and also talking about the different cold chain equipment that are available. This is very, very fundamental. And the first thing that we do to ensure vaccine security is to make sure that we have what we call a WHO-free qualified cold chain equipment that we will use to store vaccines. We don't store vaccines in every refrigerator. A refrigerator or a walk-in cold room must be WHO FQS certified before it is qualified to actually keep vaccines. That is number 1. Number 2, even when you have a WHO FQS qualified, certified cold chain equipment, because of changes in temperature within the cold chain equipment, there are tendencies that temperature can move outside +2 to +8. What do you need to do to ensure that the temperature is maintained at +2 to +8? is to put inside the cold chain equipment a temperature monitoring device. A device that will tell you that 7:03 p.m. yesterday, the refrigerator was reading -1 degrees. It stayed for 10 minutes. Then at 7:13 p.m., it came back to +3 degrees. You need that kind of a device, and that device is available. You need to continuously monitor the temperature. That is number one. As I said earlier, it is more severe and it is more dangerous for vaccines to be exposed to freezing than to heat. And if you look at that, device, once it tells you that temperature dropped below 2 degrees, temperature was at 0 degrees for an hour, then you should suspect that the vaccines inside that cold chain equipment have frozen. Especially if they are free sensitive. Vaccines like Penta, like hepatitis B, like IPB and pneumococcal conjugate vaccine, they get frozen easily when they are exposed to harsh cold temperatures. So once you get that, then you do what we call the Sheck test to verify that have they frozen or not. If they have not frozen, fine, then you use them. If they are frozen, you must discard. Even if they are expired in the next 5 years, you must discard. Now that is talking about freezing. The second component is exposure to heat. Vaccines also can be destroyed by heat, just like the oral polio vaccine. The oral polio vaccine is the most heat-sensitive vaccine. And once it is exposed to harsh temperatures, it will change stages. And for that reason, we have what we call the vaccine vial monitor. The vaccine vial monitor, if you take a vaccine vial or a vaccine ampoule, you will see a sheet of paper on it that has a square and a cycle inside. That cycle is supposed to be crystal white. Now, exposure to heat will change the color of that cycle from white to a darker color. You will continue to use that vaccine, until the color of that cycle becomes exactly the same with the color of the square. So if you look at the BBM, you cannot identify cycle. All you see is blood color. Once vaccine reaches that stage, that is what we call stage 3, you cannot use that vaccine. If you allow it to stay, the cycle will come back. But instead of it to come back as white, it will come back even darker than the square. So the cycle will even be much darker than the square. And that is the stage 4. So for heat, you use BBM to know if your vaccines are not safe. And for freezing, you need temperature monitoring devices, which can be the 30-day TR or the remote temperature monitoring device, which I talked about, that you can sit anywhere and still monitor the temperature of your cold chain equipment. I hope I've been able to address your concern. Thank you.
Thank you, my speakers. I'm sorry, we will not take any more questions. We have to leave the stage for the next session. So I profoundly thank Dr. TERESA Pounds, all the way from the US, who has given us a brilliant presentation. Dr. IKWE, who was online, and Pharmacist RABIU Mohammed Fagge for their contributions. Thank you.
Thank you. Please, it's time for the group photograph. Maybe you come together for the group photographs. Yes, thank you to our chairman, Pharmacist YARO BUDAH. Thank you to our lead speaker, Dr. TERESA ISICHEI, and thank you, Dr. IKWE, all the way from the US, to join us virtually. And also, we want to thank Pharmacist RABIU MOHAMMED FAGGE. A round of applause as they go down the stage. So we're going to call on the next session that is going to be anchored by my colleague, Pharmacist Charles. A round of applause to him too.
All right, thank you very much. So now we're going to go into something organic, talking about from the farm to the pharmacy. This is going to be mind-blowing. And we have to do this professors of pharmacognosy, pharmaceutics, and an agricultural engineer. We would like to invite the chairman of this session and all the speakers to come up stage, and I'll do the recognition while they are up here on stage. This is going to be brief, it's going to be intense, and it's going to be original. Okay, fantastic. I would like to introduce